So I'm Tammy Coleman-Epps, and I'm the Director of Media Relations and Social Media here at Prisma Health. And I'm honored to be here with you today. One, because this is an important topic, and two, because my father a long time ago was also a recipient of an organ. So that makes me really happy. So I have the pleasure to present a lot of really smart people to you today. So we have Dr. Todd Merchant, who's on. He's is the director of the Prisma Health Transplant Center, which, if you didn't know, we announced that last year. He's the chief of the solid organ transplant surgery. And he's also an associate professor at the University of South Carolina School of Medicine in Greenville. So great to have Dr. Merchant with us. And we'll add our other doctor, Dr. Superdock, who is also co-director of the Prisma Health Transplant Center, the chief of solid organ transplant medicine, and a professor of UFC School of Medicine, Greenville. Who great people. And then we're going to add somebody really special. We're going to add Jodi Schirtz. Jody is actually a donor. And that really makes us happy because she's here to tell a little bit about the story of why she became a donor, to give you some inside information on why that would be important for you to consider. So with that, I'm going to highlight Dr. Merchant, and he's going to answer a few questions that we have. All right, Dr. Merchant. So the first question would be. Okay, so we got a lot of feedback. Not really sure why I got that, but we'll just keep it going. All right. Why does this day mean so much as it relates to organ transplants?
Well, as you've already referred to, it's an extremely special day anytime we talk about the gift of life. Anytime someone steps forward, either through the organ donor registry, which they can sign up to online, or when they get their driver's license to donate an organ, it's an amazing thing to give that gift of life, or to extend the life of someone they know or don't in the future. In terms of living donors, it's recognizing those people who, for a loved one, or even sometimes for someone they don't know as well, they step forward and give a gift of life, like in a kidney transplant or even a partial liver. It's just an amazing thing to recognize those people and the gifts they give, and as well to hopefully take a moment in time to let the public know, to remind them that this is a possible thing that they could do for the people around them, that improve their life and really give other people a lease on life. We have a huge shortage of organs. And so anything we can do to educate the public and let them know about the problem that exists for people who are waiting desperately for an organ is something we want to take a leading role in doing. And so that's why we're really here today, on a day that really signifies the love you have for the people in your life. We want to take that moment to recognize people who are actively trying to improve the health of those around them.
Thank you, Dr. Merchant. What about, why is it more significant in our state of South Carolina?
Well, we have a real problem. Frankly, we have one of the largest densities of people with renal disease. We have a real significant issue with people with kidney failure. Diabetes and hypertension plays a leading role in that, and the rates of that we have in our community is higher than the national average. And so we have a disproportionate number of people in renal failure here, and especially in the African American community. And so it's a true problem for us to raise the awareness of in our community, so people understand that they're really, when they give the gift of life, they're giving it to their neighbors commonly in our area.
Great, thank you. We're going to add Dr. Superdock to add an additional few questions. All right, here we go. Dr. Superdock, what does it mean to be a living donor, and what are the requirements?
Being a living donor is basically we're talking primarily about kidney transplantation today. We are blessed with 2 kidneys. We're blessed with 10 times as much kidney function as any one of us needs to stay healthy. Physicians, typically urologists, in decades past had been removing people's kidneys because of disease, whether it was a tumor or a stone or some other problem. And they noticed people could live completely healthy, normal lives with 1 kidney. And that prompted physicians in our country back in 1954 to perform the first living donor kidney transplant in Boston. And so we've been doing living donor kidney transplant surgery in this country now for nearly 68 years. We know to donate a kidney, you have to basically have normal kidney function by all measure. You can't have any disease that could be transmitted to your potential recipient. You can't have any major health issues that would impact the survival of your remaining kidney. And you have to be wanting to give freely without coercion or being paid. And if you meet those simple criteria, you can donate a kidney to a loved one, to a friend, to a neighbor, to a stranger in need, and would be expected to have plenty of kidney function to live a completely normal life thereafter.
And what does that process look like?
So in the case where a recipient has come to us who is interested in receiving a kidney, our first step is to make sure that it's a wise and safe decision for that recipient. Once that decision has been made, then typically we encourage their loved ones to call us and express their interest in donating. They would speak with one of our nurse coordinators on the telephone and have an extensive telephone history regarding their medical history. Is there anything in their medical history that would rule them out as a potential donor? If they pass that medical history, then they'd be set up for some fairly straightforward blood and urine tests to make sure that everything measures normally. And if they pass that, then they would come in and basically spend a half a day with Dr. Merchant and myself and our social worker, dietitian, pharmacist, et cetera, and learn all about what it means to donate a kidney, what it means short-term, what it means as far as surgery is concerned, and Dr. Merchant would go over the details, what it means medically, long-term living life with one kidney, which is something that I would go over with them. And after they become fully educated and they decide that they do wish to move forward or not, we would do an X-ray to make sure that they have two symmetric kidneys with single arteries and single veins and single urine tubes. And then we would pick an operation date and they would be set up to donate that kidney.
How long does that process usually take from the time the person initially gets the initial information to the time that they would be able to donate?
Well, probably ballpark about a month. Phone call, lab work, waiting for the laboratory results to come in, coming in for their appointment, and then scheduling an OR date. Can be done in less than a month, but that's average.
Good. Thank you for that information. We're now going to get to hear from someone who actually gave the gift of life. So we're excited about that. So we're going to go to Jody. Jody, so you're up. So it's your turn. If you just give us a brief sort of overview of what happened with you and why you decided to donate a kidney, I'm sure all of our people watching would love to hear your story. Thank you for sharing it. Jody, you're muted. Give me one sec. See if I can unmute you. There you go. Go ahead, Jody.
Okay. It was April of 2008, and we went on vacation with very good friends of ours. And it was there that we learned that their family suffered from polycystic kidney disease. And our good friend's sister was in need of a kidney, and her kidneys were very bad. And in the conversation, I can't say that it was ever anything that I thought of before. I just got this feeling, and I knew it was a heart thing. Like God, I just felt like it was something that God wanted me to do. So when I saw her, I told her that I would get tested when we returned back home. And, I obviously had spoke with my husband, And he just said the same thing. If it's something that is meant to be, you'll be a match and you'll be able to go through with it. So it was just, then going through the process, I learned quite a bit, obviously, and her situation was a little different because of having polycystic kidney disease. Both of her kidneys needed to be removed. So we went, obviously I went through all the testing, and then she had to have the surgery, and then she did not do very well on dialysis at all. So then they were not sure if she was going to be able to go through the surgery. So, but thankfully it all happened on May 1st of 2009. And it's hard for me to put into words because you talk about it being a gift of life for somebody else. But I can't explain how it was such a gift for me to feel that my life had been directed in a path that the situation, the ages of my children and the support of my family and the people in my life and how healthy I was, and that it was all what I was supposed to be doing. And to be able to do that and see someone's life change and live and her children grow and all of that is just, it was just worth it. I just can't explain it. So, I mean, it's going to be May 1st, it'll be 13 years. She's never experienced a rejection. A lot of people named the kidneys, so she has Clara, and you know, it's like it was just meant to be hers. And so I'm thankful to God that He chose me and that I could experience such a gift. It was a very humbling experience. There's a lot of things in life we can't do. We can't change the beliefs of our children or people in our life. We can't, you know, we could bring children into the world, but to be able to do something for someone, to give them life, and be able to experience that is, there are no words. There are no words. So.
Jody, you said that you had written a little, well, you didn't call it a poem. You
Yeah.
called it like a little
through the
statement.
experience, right? It kind of goes with what Dr. Superdock had said. It was a realization, right? And I wrote, God knew we needed only one, but He created us with a pair, then hoped we would trust Him enough to be a donor and share.
That is so great, Jody. What do you think 13 years later? I mean, how does, when you reflect back on how long it's been, what does that make you think about?
I would do it. I've done it. I do it again. I would, if I had the opportunity. And I can't believe the time has gone by, and it's had no effect on my life whatsoever. I mean, other than the scar that I have, and you know, the healing process, but to me, it seems like a very small price to pay for what Michelle is a teacher, an elementary school teacher, and she was able to go back and continue teaching in a career, and that she'll be retiring next year. And it's, you know, it's just amazing.
Thank you so much. Anything else, Jody, you want to add?
Just that I think that if there's anybody out there that is giving thought to it, that, you know, search your heart. And if this is what you feel it's meant to be, then I believe that God will give you the strength and peace to go through it without fear or a reservation.
Thank you. The next question is about organ rejection, how often it is. I'm not sure, Doctor, who's the correct person to take that?
I'll be happy to take that one.
Okay, there you go.
So unless you have an identical twin, anyone that you receive a kidney from, that kidney is going to be seen by your body as being foreign to you. And so just as your body tries to fight off a virus or other infection, your body will try to fight off the kidney. In general, our rejection rates now that our immunosuppression has gotten so much better over the years, our rejection rate is really only about 10%. So 1 in 10 people will experience a rejection episode. Most of the time, the vast majority of time, 95% of that time, those rejection episodes can be reversed with more intense medications. And then it's very rare that somebody actually loses a kidney early to rejection. Now, over years' time, eventually that kidney will be affected by side effects from our medications, from the immune system attacking it, and no kidney transplant lasts forever. But a typical living donor kidney transplant is expected to last on average about 15 years in the recipient, and some have been known to last over 40 years.
Thank you. I'll go to Dr. Merchant for a question. I guess this is the question of the day, I'm sure.
Yes.
People want to know how soon it is before we're gonna be doing some transplants.
Well, we're getting active offers. We have multiple patients who are coming up. We just haven't had a kidney come to us yet that we were able to use. We have some living donors that are being scheduled right now in the process of that. So we'll be doing transplants hopefully in the next several weeks. But you know, the most important thing is to safely be able to transplant our patients, and we're looking forward to it. We hope that this happens very soon.
Thank you. I'll add a question to that. What is a typical wait time for someone who needs a kidney in South Carolina?
Historically, if you looked back in the last 10 years, you might wait as little as 3 to 5 years. But we've changed recently due to the way organs were being distributed were based on maybe we felt like not the fairest manner in the past. And so about a year or so ago, we updated how we allocate organs. And now there's going to be a little bit more of an equilibrium time. So we're not exactly sure, but wait times in South Carolina may go up a little bit. We're anticipating somewhere between 5 and 7 years, maybe. Over time, we'll see how that settles out. But because on the coasts in big cities, people were waiting as long as 10 plus years for an organ, and in certain other parts of the country, as little as 2 to 3 years. We've kind of done away with this, with the old organ procurement organization, drawn lines, and are now sharing organs a little bit more liberally in regions. So wherever the donor hospital is, you can draw a circle around it of about a 250-mile radius, and everyone on a list in that area, on a program in that area, will now get offered that kidney. So in the long run, for the whole nation, it's going to share organs more liberally. For South Carolina patients, it means our time is going to go up a little bit, probably. So we'll wait and see how that settles out, but it'll probably take a few years to really see where those times go. But I anticipate in the 5-year plus range.
All right, we'll go back to Dr. Superdock. All right, so the question is, what medical conditions might exclude a possible donor?
Sure. As I had mentioned before about candidacy to donate an organ, 2 of the biggest things we worry about is the ability to transmit something unintentionally to your recipient. So if someone had cancer, if someone had a life-threatening infection, those donors would not be able to safely donate their kidneys for fear of injuring the recipient. Conversely, if the donor had a major health issue that could destroy their remaining kidney, in that situation, they would be encouraged to keep both their kidneys as they would need them later in life. And the two biggest situations where that occurs is diabetes and high blood pressure. So unfortunately, many families who have loved ones who suffer from kidney failure from diabetes and high blood pressure. The diabetes and high blood pressure is just seen throughout all the brothers, the sisters, the parents, the cousins, the children, and it can be very difficult to find a suitable living donor, because certainly we would not want to take a kidney from someone or accept someone's offer to give a kidney, I should say, if we thought that they had a medical condition that was going to end up harming them and putting them on dialysis in the future.
What is the recovery time for the donor? I guess the question could be, what is the recovery time for them both, I guess.
I'll turf that one to Dr. Merchant.
Okay, let me get Dr. Merchant.
We traditionally tell patients that it's up to 6 to 8 weeks. In my experience, patients have a little bit of a different experience each time, but somewhere between 4 and 8 weeks, typically they're getting back to their normal selves. It's pretty reliably a circumstance where patients will feel better in terms of pain within about a month, or even earlier than that, not be on any pain medication, that type of thing. But getting their energy levels back and appetite back and all of those things can take up to about 6 weeks. Also, for just the healing of wounds and those type of things, your incision is at its strongest by about 6 weeks. So getting back to normal physical activity and lifting and those type of things, we tell people about 6 weeks. And that's for both the donor and recipient.
The question is, can someone awaiting transplant be listed at multiple places, multiple programs?
Sure. Absolutely. You can list at multiple places, and it will give you a bigger geographic region, as I described, that 250-mile radius from every donor hospital. So it will help you in terms of getting the most organ offers, perhaps, and that may shorten the time span that you have in obtaining a kidney. The only thing I will say is that you need to make sure that you can follow up with your donor, with your transplant hospital, wherever you get your transplant. Because that can be the only other end of that sword would be the fact that if you can't follow up 500 miles away from where you are, then pragmatically it doesn't help you to necessarily get a kidney there. And so you just need to make sure that you can logistically figure out your follow-up and those type of things. But if you can, it's in your best interest to consider multi-listing, yes.
Dr. Merchant, would that mean that the person would have to be worked up, do all the tests at more than one site if they did that? Or would their information be shared from one program?
Of course, the information is typically shared relatively liberally, but I will say some hospitals have slightly different criteria that we look at. We may want to get testing done a little bit differently at one place versus another, excuse me. For the most part, a lot of your workup and annual follow-up will be done similarly from center to center. And so that can be shared. But sometimes one center may have things you need to get done to stay listed that are a little bit different than the others. So you just have to keep in close contact with each center.
Okay, so the other thing I was going to ask is, one of the things that we've been proud of or excited about being able to do transplants in our Greenville area for people around that area is the fact that there's a lot of travel and involved in when you get a transplant. So can you, I don't know if that's the one for you, Dr. Superdock, to talk about that for a minute.
Well, I'll simply speak to it and then see if he wishes to. But of course, we think it's more convenient to be closer to home. And it can, and from a pragmatic standpoint, also, it's going to foster closer follow-up if you have to overcome less hurdles to follow up. So we do think that there's just a logistically much easier process that way. But since Dr. Superdock does a lot more of the long-term follow-up and is the guy that keeps the kidney going the longest, I'm going to defer back to him on this and let him answer that and see his perspective.
Yeah, I think I would just echo everything that Dr. Merchant said. Um, the benefit, just to sort of drill down a little bit into his comments, is that if a individual is listed for a kidney transplant at Greenville, they would have access to any kidney 250 miles as the crow flies in any direction from Greenville Memorial Hospital. So you can draw that large 500-mile diameter circle around Greenville, and that would be their access. So as they move further away from Greenville, you can think of drawing that circle on a map with the center point being other transplant centers. So you will see sort of that crescent, that sliver of increased access to kidneys based on that expanded geography. The relative benefit for a potential recipient is not large for multi-listing. There's no doubt that they would have access to kidneys from a broader geography. But I think that the trade-off, if you've just had your surgery and you're perhaps having a little bit of incisional discomfort, et cetera, and you have to go back to your transplant center once or twice that first week after you get discharged from the hospital, it's fairly uncomfortable. I just saw a patient last week who is in the emergency room here, who had been transplanted at another center and was having a problem, and that individual was getting into an ambulance to travel a great distance back to their transplant center of origin. So it's not ideal to be far away from a transplant center, but it is certainly an option. I think if you have the resources, if your family can stay in a hotel in a town far away from home, eat at restaurants, et cetera, that's fine. I think for the vast majority of people, it really makes sense to get their kidney someplace they can get to and from the office, in a half a day, particularly for emergencies after the transplant.
I would have to agree with that. My dad, Dr. Superdock, my dad actually was transplanted about 2.5 to 3 hours away from his home. And so there was a lot of travel involved in it. Now, we're not complaining. He got a kidney and used it for 9 whole great years. So, but it was a lot, especially at the end, it was a lot of travel. So there's a question about cost. And I'm not sure who this one goes to. I'll let you guys fight over this. So what is the cost to the living donor and how does that work? And I know that you guys don't necessarily do insurance stuff, but I didn't know how we answer that.
I'll throw myself under the bus on that one, because you're right. Neither one of us deal with insurance. But the vast majority of time, the recipient's insurance will cover the cost of organ donation. So in anybody who's considering donating, they would meet with our financial person and our social worker. They would look into not just the direct costs of donating, the lab studies, the hospitalization, et cetera, but also some of the indirect costs, childcare, time off work, things like that. And the whole transplant team would get together to try to help as much as possible. And when not able to help, at least do all the research ahead of time so that a potential donor can make an informed decision.
Great. I'm going to go back to Jody for a sec. Jody, when you had your transplant, you and your friend, were you guys close to the hospital where you were transplanted at? And tell me about that, coordination there.
Yes, the transplant, I lived in Rochester, New York at the time. So the transplant was done at Strong Memorial Hospital. And I probably lived 15, 20 minutes from the hospital. So I know all the testing that I had to go through, and they would schedule it and I would go. And there was no cost out of my pocket for any of it. And that in her family, she was right in the area as well. So we had all the support we needed. So it definitely did make things very convenient. Yes, time off from work. But then after I was in the hospital a week, when I got home, I was out probably 6 or 8 weeks. Some of that then you could do some work from home and things like that until I was physically able to go back. But when I first moved to Greenville and found out that I learned a little bit more and found out that there wasn't a transplant center here, you know, that was a surprise. So I was very excited when I did find out that they were getting one, because I can see where having it close by, just for having the supportive family, how valuable that is.
Yeah. Well, I don't think we have any other questions. I wanted to give you a chance, Jody, to give any final thoughts that you have, and then I'll go to the docs and let them do the same. Any final thoughts on this special day that you want to add to our conversation?
Well, I thank you for the opportunity to share. And I think that anybody that's really has a family member that's that is in need of a transplant, and those thinking about doing it, that, you know, to get the message out there, and if they have questions, to ask people, right? That's the only way you're going to know if you think that, you know, you can be a donor. And, you know, talk to your doctor about your health and things like that, and see if you can make a difference in somebody's life. And there's plenty of people out there and a lot of resources to help and answer all your questions. So
thank you, Jody. We appreciate that so much. I'm going to go to Dr. Superdock. There you go. Your turn.
Yeah, I think when you look at the need for kidney transplants in our state, the people who are waiting for a deceased donor to give them a kidney is in excess of 1,000 patients across the state of South Carolina. There are millions of citizens who live in the state of South Carolina, and you can multiply that by 2 for the number of living kidneys that are in the state of South Carolina currently. If only 10 people or 100 people across the state of South Carolina step forward to donate a kidney to someone in need, whether it be a loved one or a stranger, that would so impact the waiting list. 100 donors would drop our waiting list by 10% across the state, would drop the time that the average person has to wait for a kidney significantly, and would be a blessing to so many people. So, you know, if your heart is so inclined to want to learn more about donation, call the transplant center here at Prisma. We're not going to strap you down and steal your kidneys. We'll be happy to educate you and tell you more about what it means to donate. And if, as in Jody's case, things are meant to be, you'll progress through the course. And as you learn more and more and more, if you become convicted, as Jody was, to continue to move forward, you will certainly bless someone else by your generosity.
And Dr. Merchant.
I'll echo Dr. Superdock, who I think eloquently stated the need in the state of South Carolina. And I want to also thank Jody and all the donors out there. In terms of living donors, it's someone who consciously makes a decision to help the loved one commonly, and sometimes just anybody, when someone steps forward to altruistically donate. It's an amazing gift. And I also want to encourage people to consider signing up to be a deceased donor upon their death. That is a huge need nationally. Almost 100,000 people are waiting for a kidney, and it can make such a difference in someone's life when you're not going to utilize that kidney any longer, and yet someone else or 2 people may benefit massively from it. So I would encourage people to consider that and how much good they can do for their loved ones.
All right. So thank you, everybody. I as a daughter of somebody who received a deceased person's kidney and lived 9 whole years, that made me really happy. So our experts are here. They're at the transplant center. If you have any questions, we have a wealth of resources available to help you get the information you need.